I was recently asked by a woman after watching one of my videos about hormone replacement therapy and estrogen not causing breast cancer this question: what about if you have a strong family history of breast cancer? What do you do then? Because even if estrogen doesn't cause breast cancer, if it makes it grow faster, if it's already there, doesn't that lead to an earlier diagnosis in a woman with a strong family history of breast cancer? Number one, I just want to say I acknowledge how scary that is and that you don't know the right thing to do. It's hard when you hear different approaches and different risks and different advice. It makes it really hard to navigate. And I want to reframe the breast cancer question and the family history question, because right now, women with this strong family history of breast cancer are basically told two things. Well, maybe more than two. Let me just itemize what they are. One, don't take hormones. Well, what about all those years that they've had their natural hormones that their ovaries made? You know, when we go into hormone replacement and menopause, we're not giving the higher dose hormones that your body's used to make. We're giving a baseline level of hormones that is significantly lower than when you used to cycle. If it's bioidentical and metabolized appropriately, I don't know. I'm not quite sure that holds, but that's what women are told. Do not take hormones. The other thing that they're told potentially is have surgery to prevent it, which could be ovary removal, which could be prophylactic mastectomy. That's pretty aggressive, but I do not fault any women for doing what they think the right thing to do is. And then the third thing they're told to do is to image much more frequently, usually at frequencies of every 6 months. Often it's an MRI once a year and a mammogram and ultrasound once a year. And they're staggered at 6-month intervals so that there is some form of breast imaging every 6 months. That is a different conversation on its own, because mammograms give you radiation and MRIs are usually done with gadolinium, which is a toxic heavy metal. Could those studies started at a very young age in a woman with a strong family history potentially cause a slight increase in cancer risk because of the radiation and toxicity? So that's scary. What do you do with that? Well, that's hopefully where over time QT imaging will be adopted, and that's the no radiation, no compression, no IV contrast combination of transmission ultrasound and reflection ultrasound. That's a different topic. So they're told the three things: the surgery, the don't take hormones, and the very frequent imaging. And that's it. So look at it this way. What does that test if you have a genetic marker like BRCA? What exactly does it mean? Well, it's a deficiency in your immune system to suppress cancer. So if your immune system is not able to prevent and suppress a single cell cancer, then it is allowed to replicate and turn into a tumor. And that's really what the BRCA gene is. It's an inefficiency of the immune system to be able to suppress cancer. It doesn't cause the cancer. What causes the cancer is poor nutrition, high stress that leads to inflammation in the gut and inability to heal. Toxins like heavy metals, chemicals. We live in a toxic soup of chemicals nowadays, and microtoxins and certain infections that suppress the immune system. I fully believe that that's the cause of the cancer. Women aren't told anything that they can do from that aspect. Let's look at it basically. How about optimize your micronutrients? Good grief, that sounds pretty good. We know that zinc is important for immune system function. We know that vitamin D is really important for immune system function. Vitamin C is good for the immune system. Magnesium. So at your regular appointments, how often are those tests run? Hardly ever. It's not part of the algorithm for a screening exam. If you come to our practice at Vitality Renewal, we sure do them because we believe how important micronutrients are. So what about optimizing your micronutrients? What about optimizing your metabolism? We know that breast cancer is a metabolically fed cancer. It is highly susceptible to carbohydrate issues. So if you don't metabolize carbohydrate well and you have high insulin resistance, prediabetes, or diabetes, that's a risk for worsened breast cancer. Breast cancer is one of the cancers in general that responds well to a ketogenic diet. But are women with a strong BRCA history told to evaluate their A1C, which is the marker for how well you metabolize carbohydrates, are they told to evaluate that and keep it optimum? I doubt it. In fact, normal range for A1C is highly skewed. It's not healthy. Metabolically healthy A1C is going to be between 4.8 and 5.2. And we tell anyone that is less than 5.6 that they're normal. So that's not told. You know, there's an association of high copper with breast cancer. Breast cancer recurrence is how it's studied, but looking at your copper zinc ratio, because copper is necessary for angiogenesis, which means blood vessel growth. So those are things that you can do, things that you can actually do to support your immune system. What about evaluating your environment for toxins? We're not told that at all. I mean, we look at, in traditional medicine, acute exposure to lead, to carbon monoxide, things like that. But nobody really checks chemical exposures like plastics, pesticides, herbicides, unless it's an acute liver kidney failure from an overwhelming high dose. People are not checking these low levels that build up over time that overwhelm the immune system. What if a woman did everything she could nutritionally, micronutrient-wise, healthy living, toxin minimization? We can't control everything, but let's look at what we can control and then do an improvement in our body's ability to eliminate those toxins to keep the levels low. What if we did that? What if we looked at mindfulness and stress reduction so that we had the resiliency and the ability to heal? If we did all of those things, that's going to be a lot to support the immune system rather than just, you have BRCA, your only options are prophylactic surgery, don't take hormones, and screen frequently. There's so much more that can be done. The hormone question is very nuanced. It has to be discussed individually. There's risks and benefits. And if you do have a strong family history, there may be an increased risk of earlier cancer in your life. It may have already been there. It didn't cause it. It may have already been there. But what if we do all those other things to support your body to prevent cancer? I think that's the right answer. I think that's the better question. I'm Dr. Yvonne Karney. I'm here to support you in your health throughout your whole life. If you're wondering if you have hormone imbalances that could be triggering issues that lead to medical problems, take my hormone quiz. And if you have other questions, we're here for you. Reach out.